Hello, my name is Dr. Lakendra Fulbright. I am a licensed chiropractor in the state of Georgia. I wanted to do a video today demonstrating an adjustment for a newborn, and I'm going to be using my 2-week-old Joa as the patient. But before I get started with the adjustment, I wanted to just talk about why a baby or a newborn would even need to be adjusted. Primarily in my office, when adults come in, they have some type of pain complaint or they have some type of injury that I'm correcting. So for a baby, they don't complain of pain or any type of discomfort. Generally, they have some type of symptom. But when a newborn comes into my office, I would evaluate them based on their health history. We talk about mom's pregnancy, we talk about the delivery. Any of those things can actually create potential problems, imbalances, or injuries in a newborn. So when we think about the process of birth, that is a trauma. That's a traumatic experience. Now, back when I was born, my mom was actually telling me that they used forceps to pull me out, and I actually had marks on my head for a couple of days. So you can imagine how back in that time when they used forceps and a vacuum or suction type device, how that could create injuries. But even now, with just the most natural of births, or even with a C-section where they're pulling you out, that does involve some type of trauma and it can lead to an injury in a newborn. When people have been in car accidents, a lot of times they suffer from whiplash injuries, which is basically an injury to the muscles in the neck. Well, when a baby is born, and let's say with a C-section they're being pulled out by their neck, that can create an injury. Let me get my baby. Okay, Joa. Okay. You ready for your adjustment? Okay. So with newborns, they can get that same type of injury that we would get as an adult in a car accident. So how we would get maybe a whiplash injury from the birthing process, babies can get musculoskeletal injuries as well. One of the most common injuries that we see in newborns is something called torticollis, and that's basically where one of the muscles in the neck is spastic or tight, and it's asymmetric on one side, where it's one side that's tight and the other isn't. And the particular muscle is abbreviated, it's called the SCM muscle. And it's this muscle right here that's in the front of the neck. So you have one on the left and the right. And sometimes what can happen when the baby is being born, one of those or both of those muscles can be injured. So that's one of the things that we evaluate for in my office, by either palpating, feeling the tightness in the muscles, or it can actually show up as an abnormality in the way they're holding their head. So if that muscle is spastic, it can cause their head to turn one way and kind of tilt. One of the other things that happens as a baby is about to be born and coming down the vaginal canal, their cranial bones actually collapse in. Now, it may sound like a weird phenomenon, but anybody who's seen a baby being born or has seen your own newborn when they come out, you'll notice that their head is kind of cone-shaped or pointy, and that's because as they descend through the vaginal canal, in order for them to fit, those cranial bones have to collapse. So the skull is not just one continuous bones, it's several different plates that has sutures connecting them. And it's not fully formed, not fully ossified in newborn babies. So a lot of times that appearance of the cone-shaped head can resolve on its own, or like our mothers, our grandmothers did, they did what's called molding the baby's head. So a lot of times that can resolve on its own. But sometimes it does require some type of intervention. So again, as a chiropractor, that is something that I evaluate for babies. So why would I adjust a baby? Because of musculoskeletal injuries that could occur during the birthing process. So then the next question is, how do you adjust a baby? And you'd be surprised at how many people think that babies get adjusted the same way as adults, which is not true at all. For one, a baby's bones are not fully ossified. They have a lot of cartilage, especially in the joints. So in our joints, we have gas And when I deliver an adjustment, a lot of times people hear a pop or a cracking noise. That's called a cavitation. And that's basically where gas is being released from the joints. Well, babies don't have that. And also, there's not necessarily a thrust or a push that's involved with the baby adjustment. Newborns, they are adjusted with light touch, pressure, gentle massage. So it's a lot different than with adults. All right. So he's getting a little fussy. So I'm going to go ahead and do his adjustment so that you can see how it goes. Okay. Yeah, I know. Now he's been quiet the last 15 minutes. And of course, when I turn the video on, he wants to get live and drink a little milk. I'll calm him down a little bit. A lot of people have questions about the safety or the efficacy of babies getting adjusted. And if you wanted to do some reading up on the research, I'll be sure to include those links at the end of this video so that if you want to check it out on your own, you can. But generally, I think people have a hesitancy of the safety component of adjusting a baby just because they think I'm cracking a baby's neck. And that's not what happens when you adjust a newborn. So if I can get him calm, I'll go ahead, bring the camera down. Okay, Joa. So one of the first things I do is I check the muscle tone. Remember I talked about torticollis, which is the muscles in the front of the neck, but also I check the muscles in the back of the neck as well. The muscles at the top of the neck connect to the skull. Okay. Let's see if I can calm you down. First. All right. So I actually do him seated. So what I'm doing right now is I'm just palpating or feeling the muscles and the joints for any type of imbalance or tightness. And right now I can feel that there's a little bit down here, Joa. There's a little bit of tightness here in the top of the neck. Now, why is it important that these things are balanced and symmetrical? Why does it matter if there's tightness in the neck or a misalignment of the joint? Well, it can actually affect the baby's ability to thrive. For instance, if a baby's head is not molded correctly and the head is flat in the back, that's something called plagiocephaly. Now, most people would think it'll clear up on its own or it's something that's just cosmetic. But if the back of the skull is flat, that can actually lead to an underbite or a misalignment of the jaw, and that would affect the baby's ability to feed even at the breast or with a bottle. So that's not just a cosmetic thing, but that's going to have some type of functional effect, and it's going to affect the baby's ability to thrive. So as a chiropractor, one of the things I want to do is I want to check that skull to make sure there's not an excessively misshapen head. And there's more than one condition, but plagiocephaly is one of the ones that affects feeding the most. The other thing that I mentioned, torticollis, that affects the muscles in the neck, and that can cause also problems with breastfeeding or feeding with the bottle. So again, anything that's going to affect a newborn's ability to eat and grow and thrive can potentially cause a problem. All right, so I got him calm. Let's see if I can go ahead and do his adjustment here. I identified some tightness in the muscle here in his neck, so I'm actually going to use my pinky. Stay here, Joa. And all I'm doing with my pinky is I'm stretching that muscle out. So I'm just running my pinky up along the muscle, and I can actually feel the muscle loosening up, and the tone is the same. Now, I also feel a little bit of restriction or misalignment in the very first vertebrae in his neck called the atlas. So again, I'm going to use my pinky as a contact, and I'm just going to apply a gentle pressure here. I know. He's a little hungry, so. There. Okay, Joe. Okay. So, I just did some muscle work on his suboccipital muscles, which are the muscles that attach to the base of his skull and the very first vertebra in his neck, called the atlas. And I also adjusted his first cervical vertebra, or his atlas. All right, Joe. Let's bring this camera back up. Now, one of the other things that I check for in babies, not just the top, the cranium, the skull, the muscles in the neck, the vertebra in the neck, but I also check the sacrum and the coccyx down here at the bottom. And that's important because that is the foundation of the spine. So if there's any type of imbalances or misalignments in the sacrum or the pelvis, that can affect the entire spine. So generally with babies, the two areas that I check are the top and the bottom. So he's a little bit fussy and he's hungry, so I'm not going to check his sacrum, but one of the things I do is palpate. And palpate is basically just feeling the joints, feeling the muscles to see if there's any imbalances there. The way I would correct his sacrum is, again, I would use that pinky contact on the ST, or the sacrotuberous ligament. And that ligament connects to the sacrum. And generally, it's just like adjusting the neck. It's just a gentle pressure or a little hold. And afterwards, you always go back and check, make sure everything is balanced out. It's generally not a lot of muscle tension in a newborn, or not the same amount of muscle tension as there would be in an adult. And that's part of the reason why it doesn't require a lot of force to adjust them. Just a little bit of pressure, a little bit of massage. So I will hopefully try to do another video of some more newborns, and then maybe even next time I'll do an adjustment of a toddler so you can kind of see the difference between them. But I hope this was informative for everybody. If you have any questions, you can email me or you can reply to the video. Again, if you are interested in seeing some research on the safety of baby adjustments, I will try to include that link at the bottom. There's a lot of good resources there if you're interested. So thank you for watching Joa's first adjustment. Are you going to wave? I don't think he's going to wave. All right, so thank you for your time, and I'll see you next time.